Happy Tuesday. Thank you so much for joining us today. My name is Emily. As I said, I'm the Marketing Development Manager at the Dance Current. This is our third and final session in the Body Talks Dance Health webinar series. We really appreciate you joining us this evening. I'd like to acknowledge and pay respect to the Mi'kmaq people on whose unceded territory I'm working from today, as well as the Anishinaabe, Mississauga of the Credit, and the Haudenosaunee peoples on whose unceded territory our educator, Dr. Joyce Fu, is joining us from. I encourage you to think about your relationships with the land, the animals, and the waters wherever you are joining us from. How do you engage with them, care for them, and protect them? I've been planning a summer garden for my balcony, and I'm thinking about what kind of space might be safe, friendly, and welcoming for the wildlife and bees in my neighborhood. So before we begin, our series sponsor, the School of Toronto Dance Theatre, would like to take a moment to welcome you. So I will just share my screen here.
Okay, recording.
Hello, and welcome to Dance Current's Body Talks. My name is Sasha Agnochko. I am the Artistic Director of the School of Toronto Dance Theatre. The school is excited to be the series sponsor of this free dance health webinar series. We hope that you will gain practical tips and anatomical knowledge to help you move with greater strength, ease, and confidence. Thank you and enjoy.
So as we only have an hour, I will quickly introduce our educator this evening, Dr. Joyce Fu. Dr. Joyce is a chiropractor, yoga and dance teacher, and acupuncture provider based in Toronto. She owns J Fu Chiropractic and is a contributor to the Dance Current as well. So we are thrilled to have her as a sponsor this year and her support as a partner in this series. Dr. Joyce will be leading today's session. However, if you have any questions, please feel free to pop them in the Q&A section, and we will make time to get to them at the end. Please note, by participating in the movement portion of this session, you are assuming any risks involved. So over to you, Dr. Joyce.
Thank you so much, Emily. I always find it's good to acknowledge the land we're on. It's always refreshing and really nice to hear that. So yes, just because we have an hour, I'm super excited to present this topic that is near and dear to my heart and close to why I actually became a chiropractor myself. And so here we go. We're gonna go straight to, I'm gonna share my screen and you're gonna see my slides, hopefully. Should be a full screen there for you. So just note that the first part of this webinar will be more based with research, more talking about what dance burnout is, and the majority of it, I actually want to do more of a movement therapy session with you all. So hopefully you have your yoga mat out, you have some of the props we delineated, which was a massage ball, 2 yoga blocks or a foam roller, and a resistance band. But yeah, less talking and more learning. So the third topic of this Body Talks is addressing dance burnout and injury prevention with yoga therapy. And so this is my little welcome page, just so you are reminded again that you can put any questions you have in the Q&A, and we can spend a little time after our session to address any concerns or questions you may have. And then if you'd like, you can also show your camera for the class, or maybe not, it's also totally up to you. And a little bit about myself, just a little bit more. I actually did start as a professional hip hop dancer, and that led me to multiple injuries because there was no such thing as dance rehab. It was never taught, it was never emphasized. It was always, you know, just shrugged off and kind of like too bad. And I didn't like that. So I did my own research. I did basically kind of, you know, built my life around why these things were happening. And I did my yoga teacher training in Toronto as well, and got through that finally to finish with chiropractic. And I also provide acupunctures, multiple tools and ways to treat people of different conditions. And just a little health disclaimer that none of this you should take as a diagnosis, a cure, or anything. but it is for educational purposes. If you do have any specific concerns, you're more than welcome to reach out to me, and we can have more of a one-on-one discussion where I can give you my clinical expertise of what I think is happening. So some of the learning objectives, we will identify what is dance burnout. And I'm sure we all feel it, but it's more like, what are the words we use to describe this, this kind of phenomena, I guess. There's also research, surprising. There's research that actually supports that this is occurring and how we can address it in a healthy way. In addition, there's also lots of more research and support for this is movement therapy. What is it? Why is it important? And how can it provide us with more preventative techniques that we can incorporate right now to get our bodies back into shape so we can do our next gig or go to rehearsal without feeling drained. And finished off with the movement-based learning. As I mentioned before, my specialty is to actually merge yoga and Pilates together, which is the perfect blend of yin and yang, I find. We get a little strengthening, but also get to ground ourselves through more yoga. So of course, the question is, what is dance burnout? And through my research, I have found that all of these descriptors were quite accurate. It is a state of consistent or unexplained tiredness, poor performance in spite of normal training. So if you think about, that period of time when you had a contract and you were supposed to dance Monday, Wednesday, Thursday, Friday, that's the normal training, but you still didn't feel like you could fully go full out the whole time. That's a kind of an acute sense of dance burnout. A negative mood state, and also increased incident of illness or injury. And some synonyms to describe this same thing or same phenomena is overtraining or chronic fatigue. So you'll notice that all of those points on top touch upon different aspects of dance, right? So it's the physical part, because poor performance, tiredness is more of a mental and physical, I would say. The negative mood state is mental, emotional, and then the injury is physical. So there's tons of stuff that's obviously contributing to this phenomena, more than just working out too much kind of thing. That definitely doesn't happen. And here's a little highlight of me back when I was performing still. And this was definitely a time I recall when I had recovered from burnout. And it really took me a lot of work to get back to that feeling of loving what I do and loving performing, which is still what I love to do. But it took a while for me to get through that loop on my own journey. So why does this actually happen? So there has been research showing that, like, this diagram will describe to us exactly what happens in our muscles, for example, or any kind of tissue. So different tissues in our body, muscle, tendon, joints, bone, right? So all of them can actually recover and build more of in our body, even bone, which is how, fractured bones can actually heal. So for us, most concerning is tendon and muscle, right? As we know, it pulls on bone and it gives us contractions and able to move through our body. So if you can see with the diagram, an exercise load, think of that as like your rehearsal, your gig, any kind of performance where you have to use your body physically, right? You put that load on your body, then our muscle, so think about your y-axis as your muscle recovery or your muscle strength. So once it goes down to fatigue mode, that's because we have actually caused micro tears in our muscle and tendon. So it's physically broken and it cannot recontract in the same way to create more pressure. And so there is a lag period following that called recovery or rest. And thinking of grade 9 science, we have a slope here, meaning that it actually takes more time to achieve a certain level of adaptation, which is the next step. Now, many times when we do not honor this recovery or rest period, and think about it as more compounded with another exercise load. If we go back to dance too quickly, we take back-to-back dance classes, whatever it is, you're compounding this exercise load a lot more. So you're actually dropping your fatigue level further and further down. Therefore, meaning your recovery and rest period needs to be further and further out, meaning more time. But most schedules, most contracts and things like that don't allow that, or don't actually build that into their schedule or programming. So this is how we achieve the physical burnout in our tissues. This is also by a very interesting paper. If anyone else wants to read more clinical knowledge about what burnout is physiologically, it's a great paper that I can share as well. So through that, they found that in professional dancers, approximately 75% of injuries occurred during performance times of the year, even if dancers were not actively performing at the time of the injury. And that just re-emphasizes that compounding effect of having too much exercise load and not having that proper recovery period for your tissues make us more prone to injury. And this finding may not only be a reflection of greater volume of dance exposure during these periods, or may also be due to increased susceptibility of injury due to fatigue. So the fatigue component is where your cells actually don't have enough nutrients, don't have enough oxygen and things like that to repair the tissue in time. And that's what causes that fatigue. Hopefully I haven't lost you guys yet. But basically what I'm trying to say is using your body too much in one capacity can definitely drain it of the resources in order to make it stronger. And so we need to just provide enough resource, enough tools and enough time to give it the proper building blocks to achieve a stronger state. And then we keep doing that again and again and again, and that's how we get stronger. So this is where movement therapy comes in. And movement therapy is actually a thing, like, just as physiotherapy is a thing and chiropractic it's a thing too. So there's lots of different types of therapists that incorporate this type of approach in their treatment style, aka like the way I would, because I'm a yoga teacher and chiropractor. So that's my merge of the two. And it's a range of Eastern and Western mindful movement practices used to treat the mind, body, and spirit concurrently. It's a holistic approach, and it offers an opportunity for a state of complete physical, mental, and social well-being, and not merely the absence of disease. I really like that line because that tells me you are thriving and not just surviving. And for me, dancers, performing artists, we are people who truly are thriving when we're on stage, or thriving when we teach choreography or teaching kids or things like that. And we shouldn't just draw from that survival mode. Like, that's not inspirational at all. And so there's tons of research showing chiropractic and yoga can help with reducing injury and illness. Because we help speed up the process for the muscles, tendons, and joints to recover better. We do this through joint mobilization and soft tissue therapy. It's also shown to relieve fatigue and aching muscles, and we do this by stretching specific muscles, strengthening antagonistic muscles, and also guide you for more active recovery tools and techniques. We also prepare you for higher loads. And how do we do that? Because since we're increasing your recovery time, you can adapt much quicker, right? And so you're able to, say, do higher loads of rehearsals or higher loads of jumping type of techniques, things like that. And we do this by fixing your biomechanical alignment in your spine, in your ankle, in your wrist, anywhere in your body really, and provide specific rehabilitation for it. And in addition, in the class, we will start to challenge your muscle and joints in different ways that actually complement the movement you're doing in rehearsal or your performance. And that's how we can decrease the load in your body as well. It's also been shown, especially with yoga, By improving mindfulness and relaxation techniques, we can address mental fatigue, and that's a huge component of burnout as well. And we can also prevent a ton load of other conditions. So conditions related to the heart, cardiovascular, immune system. So are you getting sick more often? Do you have a bruise or like a cut that doesn't heal as well? Those are all signs your immune system has been weakened a bit more. Also your mood and cognition. These are all huge things that we should address in dancers, because we are a full human. And yes, we use our bodies as a vehicle to express ourselves, but we need to address all components in order to be fully thriving. And so who else can support you? And there's tons of resources out here, but chiropractic, Pilates, yoga, naturopathic doctors are great resources to have as well. They know tons about supplementing. They know lots about the visceral organs and more about the different hormonal systems in your body that regulate mood and things like that. Counseling is also good. Family and friends, of course, and many, many more. So part of my mission as a practicing chiropractor, yoga teacher, and mindfulness coach is to integrate optimal recovery as part of dance programs to improve fitness, physical performance, and overall well-being. And so the next portion we're going to be moving, and this is just a little run through of what we will be working on. So number one is the diaphragm and breathing properly. Focusing on rib mobility, and this can be done standing, supine, or seated. We'll start with our pelvic floor, our pelvic curls and circles, and bringing awareness to how that is in relation to your ribs. We'll also incorporate some massage ball work to help you decompress a bit, and maybe you do have some tight hips or low back and shoulders, and we can kind of work into that. I like to complement this with a little bit of strengthening component with the resistance band. And then I wanted to maybe spend some time on the feet, because dancers use their feet in all various different ways, and that's definitely the foundation of movement. And then the last part of class, we'll wrap it up with a mini Shavasana, but it will be on 2 yoga blocks or a foam roller, whichever you have at home. And that's just some information on how you can find me and things like that. While I am setting up for the class, I'm just going to ask if you guys have any questions, concerns right now. You can type it in the chat box or get ready for the class component. I'm just going to prepare myself too. So give me 1 second. Okay, so hopefully I have found you on your mat. I can't see you at all, but hopefully you can see me. I'm currently at my Yorkville clinic, and it's actually a part of a Pilates studio as well. So there's lots of movement and great community here. And so hopefully you have your props. You can keep it close to you. The blocks we'll use a little bit later, so you can just put it off to the side. And then resistance band and massage roll, right? Just put them off to the side here. All right, so at the beginning of class, we're going to focus on breathing effectively with our diaphragm and not so much our neck and shoulder muscles. So I want you to start with a seated position, crossing your legs just like this. Your wrists, you're going to just hang over your knees. You're going to inhale, shrug your shoulders up for me. Letting a big sigh out. And again, inhale, shrugging the shoulders up. And letting a big sigh out. I'm going to do that one more time for me, and begin to close your eyes as well. Inhale. Bring the awareness to your internal environment, and exhale out. Begin to close your eyes here. Begin to notice your breath. Many times in dance, we're very focused on the mirror, the reflection, how we feel about that. Maybe we're judging ourselves. And this is a time for you to kind of detach from that thinking into that cycle and bring your awareness more internally. Notice where you're bringing your breath. Is it more to the chest, the top of the shoulders? Can you think about lifting the crown of your head up towards the ceiling and dropping your shoulders away from the ears as you inhale? And as you exhale, can you feel your sit bones pressing down into your mat? Can you expand to the sides of the ribs now, the front body and back body? And thinking about lifting through the crown of the head, dropping the shoulders down and away. Beautiful. From here, we're actually going to change our position. We're going to start to lie on our back, on our mats. Our knees can be bent, and I want you to place your hand, your pinky on your hip bone and your thumb on your rib cage. And from here, we're going to continue breathing, closing your eyes if you need to. Inhale, breathe into the belly, expanding like a balloon. Exhale, feel that belly button drop inwards. And again, inhale, breathing into your belly. And exhale. Now, by now, you may have noticed that the breathing has calmed you down. And this is a natural reaction of our body to stimulate our parasympathetic nervous system with deeper, more intentional breathing. And so I want you to think about expanding through the sides of the ribs. The hands may expand sideways as you inhale. And exhale. Good. Now I want you to think about breathing more into your thumb region, so your upper ribs. See if you can isolate the breath more to the top part of your lungs. And exhale. Now breathe more to your pinky side, so your belly starts to lift up. Exhale. Now try to breathe into your back body, like it's pressing against the mat. Inhale. And exhale, feel it soften. You do that one more time. Inhale to the thumbs, upper ribs. Exhale here. Inhale to the pinkies, the diaphragm. Exhale. Last one, inhale to your back body, back ribs. And exhale. Beautiful. Just breathe a bit more normally now. You can relax the hands by the side here. And yoga is a wonderful mind-body practice that brings us to our present moment. And so it removes any stress that may have occurred in the beginning of the day, or anything you're doing after will be the future. So really try and focus on current sensation through the body and the mind. Perhaps you find it a bit difficult to concentrate on the breathing, but trying to acknowledge that and without any judgment, noticing that it's who you are and it's actually your ego that's kind of thinking a lot more. Beautiful. From here, I want you to start to interlace your fingers and you're going to reach them over your head. Your feet is going to go nice and long. You're going to stretch your body nice and long here. Deep breath in, arching the back. Big sigh out, exhale. Good. One more time, inhale. And out, exhale. Beautiful. So we're still on our back here. And our hands, now we're going to place it over our hip bones. And from here, I want you to start to do some very gentle pelvic tilting. So inhale, of course, to our belly. Exhale, you're going to round your pelvis in and round, pulling up towards your navel. Inhale, arching the back. And exhale, rounding in and up. And again, inhale, lengthening your tailbone down towards your heels. And exhale, rounding in and up. Last one. And exhale, rounding in and up. So the pelvis is super important for awareness of our core, our low back, our spine, our breathing. So it's kind of like, it's a very important cornerstone for mindfulness. So from here, I want you to start to breathe into your belly. And we're going to start to round the pelvis in and up and just do a mini bridge. Just peek the bum up and then relieve, placing your spine back down nice and slow. Inhale, arch the back. Belly expands. Exhale, round, lift, and press through your heels. Mini bridge up. Inhale at the top. And exhale. Unravel your spine. That's the word I was thinking of. Inhale, arch the back. Exhale, round and lift up. Inhale at the top. And exhale, lower down. So I want you to think and feel if you felt that more in your hamstrings, or did you feel that more in your glutes as you were lifting the bum up? So now our focus is trying to increase more awareness in our glutes. So I want you to inhale again to your belly. Arch the back. Exhale, round and lift, but this time not as high as you can. Just keep it nice and low and just gently press your bum. See if they're a bit tighter than normal. If it is, then we've gotten your glutes. Inhale. Exhale, round and lower. So many times it's very easy for us to recruit our hamstrings and our quads to do the work of the glutes. This is why I wanted more focus. Inhale. And exhale, round and mini lift up, even smaller than you can imagine. Now breathe into your back ribs here, press against the mat. And exhale, lowering down. Beautiful. Now let's windshield wipe our knees side to side. Just noticing how this feels in your core, obliques, low back. Hands can be in cactus shape here or a big T. Totally up to you if you have that space. It's accessible for you. Beautiful. Now let's bring our knees into our chest. Give them a little squeeze, round your back. Gently rock side to side. Taking a deep breath in. As you exhale, gently walk up. And come up a couple times, massaging the back of your spine, muscles around the spine to a seated position. Beautiful. So hopefully you feel a bit more centered, grounded. At any point you found frustrating or found your mind just kind of not being able to stop, that's just part of the practice of meditation and breathing. All right, the next step, let's focus on upper body posture. So we're gonna grab our resistance band, Once you've grabbed your band, we're going to hold it at shoulder height and you're gonna gently pull it apart for me first. With this gentle resistance, you're gonna feel your pecs begin to fire here, all right? So we're gonna inhale to the diaphragm. As you exhale, lower your shoulders down and away from the ears first. So you notice, right, not this, but creating a space across the collarbone and really feel the engagement through the back of your shoulder blades, looping it down, maybe a little pinch through your armpit, right? That's your lats being engaged. Inhale here. Keeping your spine nice and tall, you're going to start to lift your hands up just a little bit. Take an inhale, keeping the collarbone nice and long still. As you exhale, lift it up just a touch more. See if you can create this beautiful frame beside your arm and your head. So not so much like this, but more like this, keeping your shoulder blades engaged and down. Deep breath in. Exhale, just a touch more. Who thought lifting your arm over your head could be so tough? Inhale here. Beautiful. Exhale. Stay for a moment. Now we're going to gently lean to the right side. My bottom hand, my right hand is going to start pulling down a little bit. Top hand pulling up. You'll feel a stretch through the side, left side body. Inhale here. And exhale, coming back to center. Just going back to our neutral resistance. See if your shoulders peeked up. Gently encourage them to come all the way down. Inhale. Exhale, bending to your left. Left hand pressing down. Right arm pressing up. Feeling the right side engaged now. Inhale. As you exhale, gently bringing your body back to center and letting that go for a moment. Shoulders to a couple circles. Forward and back. So that was a lot of mindfulness and awareness of our scapula and different positions they could be, right? And most times we're carrying it in our shoulders. So it's a really, really good awareness to remember to engage other muscles as well. Now we're going to grab our massage ball. We're going to actually place it in our glute med. So it's maybe if you, from your previous Body Talk webinars, have learned the glute med is kind of in this top upper corner of your buttock. So that's where we're going to place it. We're going to lie down once again. And I'm putting it on my left side first. So my right leg will go straight. My left leg stays bent. And what we're going to do is open the knee up to the side and bring it back. And here we're going to bring more awareness to the left glute. But notice, if you're also holding any tension, any stress in this area. And how it feels to lean into it a bit more and to be vulnerable, and that it's okay. Do a couple more here. And last one, left leg out to the side. Good, now we're gonna bring our left knee into our chest. Clasp your shin with your hands. And we're gonna start to do little circles with that knee in one direction. And again, just noticing how the pressure feels shifting as we change positions and do different mindfulness exercises for glute med. Now start to switch directions in a different, circle in the opposite direction. Good, now placing that foot back down. Now we're gonna shift the ball up to your low back. So on the left side of your spine, so your spine should be a divot at this point, and you're gonna place it just off to the left. And you're gonna lie back down on it. And here you should already feel a bit of pressure and tension. And we're gonna start to pull our left knee once again. Now this will feel more intense, of course. Take a deep breath into your belly. And as you exhale, imagine you're softening the muscles around the massage ball. Inhale again. And my shoulders are nice and relaxed. I'm not letting them creep up as well, really trying to engage with my lats, pulling my left knee to my left armpit. One more inhale. And out. Now gently release that foot back down to the mat. And we're gonna start to open to the side and bring it back to center. Out to the left and back in. And last one here. And in. Beautiful. Now let's switch sides. So the ball now goes to the right glute med or the side bum muscle. Right foot bends, left leg straight, and begin by opening the hip, right knee out to the side. And just noticing and you know, doing a body scan. Is this side tighter? Does this side feel different than your left? So all of these techniques, right, we're incorporating in one class, but I know it could be a bit overwhelming, but all of these techniques do end up speeding up recovery, and they help with mind-body awareness. So even if, you know, you did your rehearsal earlier today and you felt, or maybe you taught class and you felt, I'm not 100%, hopefully this will give you some help or some relief or some confidence that you can also do this on your own. Okay, now the ball moves up to the right side of our low back once again. And we're gonna pull our knee in and bringing your right knee to your right armpit. Take a deep breath in. Exhale, imagining your muscles just like softening around the massage ball. For 2. Last one here. Beautiful. Releasing that foot back down and softening the knee out to the side for 5, 4, 3, 2. The last one here. Beautiful. Now let's remove the ball away. Now we're gonna start to sit on up. And we're gonna come into a tabletop position. Tabletop, let's do cat-cow. So as you inhale, drop the belly, expanding your collarbones, gaze comes up. Exhale, round, and lift the belly in towards your stomach. 2 more, inhale. Feeling the stretch in your abdomen, exhale, rounding. And last one, inhale. And exhale. Beautiful. Hopefully that was a good reset for you. Now we're going to start by lifting our left leg forward into a low lunge. So hands on either side of your left foot. I'm going to move my mat a little bit so you can see kind of what my foot will be doing. So my hands are on either side and we're going to gently lean into the right hip. Now from here, I want you to tuck your right toes under you and start to lift that back knee up, really nice and strong. Now with this front knee, I want you to squeeze inward to midline. And then in your upper body, create a little dome. So we're actually starting to strengthen our hip flexors, our quads, our low back, and breathe into your belly here. Exhale, try to scissor your hips. So your left heel pulls back towards your right toes. You feel your left hamstring start to engage. And it's almost like you can float your left foot up, but not just. It's more of the intention of doing so. Deep breath in here. For 3, for 2, and 1. Begin to lower your right knee down. Walk your hands back. Your left toes will begin to lift. And we're gonna fold forward, hinge forward over that left knee. Doesn't have to be straight. What we want is to feel the eccentric pull of our calves and our hamstring. A breath here and out. Then begin to walk your hands forward once again. And we're going to switch sides. Left knee back, right foot forward. Same thing, framing the right foot. Start to lean into the hip. Left toe begins to tuck, lift that knee up. And when I lift up, I'm really trying not to move my pelvis high. It's really staying nice and low. This is practicing end range or tensioning our tendons so that they're nice and strong. So for hamstrings, that's a common one for dancers, a hamstring tear or tendinopathy. So this is really good training for that. Again, begin to dome your upper body. Drag your right heel back towards your left toes. Breathe into the belly. Hopefully you find this fun and exciting and challenging for 3, for 2, and last one. Good. Left knee drops. Now walking our hands to the back, right toes lift, and begin to hinge over that knee. And hold and breathe for 3, for 2. Last one. Beautiful. Walking back forward, right foot back. Let's do a mini child's pose. I like to keep my knees together for this one, just so you have more lumbar traction. You feel it in your upper back perhaps, or shoulders. And just allow yourself to be heavy here, forehead on the mat, shoulders softening. Deep breath into your belly. And exhale. Good. Now let's begin to walk our hands up to our seated position. Good. Next prop, we're going to use a resistance band. And this will be really good training for our glutes and obliques, which tend to be, one side dominant in dancing, depending on which style, but for sure, I'm noticing that dancers tend to have one stronger side, one weaker side, so we like to balance it. So you're going to place the band underneath your left foot. We're going to lie on your right side, okay? So the right side, your hand can be down here. You can rest on the arm, or you can prop yourself up as well. Totally up to you. So from here, I want you to imagine that your left foot is being pushed away. So you'll notice my bottom hip begin to lift up. This will start to engage your left obliques actually. And that is the stabilizer. That's the part of your deep core as well. And you want to keep this stable so your left hip can begin to move, right? So let's try to find that length, like your left leg is growing long. And then what we're going to do, holding the band in one hand, you're going to start to lift your left hip up and down. Yeah. Up and down. If you want the left hand, I like to place the thumb on my bum, and that's where I will feel the work in my glute med. And imagine this part is not almost collapsing this way every time I'm doing it, but it's really holding that length down and away, and then lifting the leg up and back. You should feel it immediately in your hamstrings and your glutes. We're going to do 3 more like this. 1, 2. Beautiful. And 3. Good. Now point the toe. We're going to do small little circles, still keeping that length. This hip, trying not to move it as much. 2, as small as you can. 3, 4, 5, 6. Switch. 6, 5, 4, 3, 2, and 1. Good. Hopefully you felt the little burn we started to create. And we're going to do the other side. And over the right, underneath the right foot here. Left side, lying on the left. You might notice a different side to side if this is your stronger side. So again, begin to press that hip down, that foot down, and start to feel your right obliques this time begin to fire. When you're ready, your hand can be on the hip, and you're going to lift the leg up. And 1, 2, 3, 4, 5. And notice if your heel is in front of your body or actually down along your spine, which is what we want more so. 4, 5, 6, 2 more, 7, and we're already starting to feel the burn, and 8. Good, now point the toe. We're going to do small circles, and notice if you're wobbling all over the place, that's not what we want. We want to keep this part, like I said, nice and stable as we move the lower leg. 2, 3, 4, 5, 6, other way. 1, 2, 3, 4, 5, and 6. Beautiful. Let's drop that band away. Good. Let's come back to our seated position. We're going to do a little stretch. Let's do double crisscross our legs one over the other. Maybe the knees begin to stack. We're going to anchor down our ankles just a bit as you hinge forward, and you'll start to feel that stretch on both sides. Deep breath in and out. And one more time, inhale. And out. Beautiful. Sitting on up. Let's switch sides. So all of this movement, breathing, awareness, mindfulness is technically building a map in your mind of kind of where needs more attention, where do you feel the strain or the discomfort, and knowing that the more you do this, the better it will feel. And then sitting on up, beautiful, and start to shake your legs out in front of you. Now I want to do some footwork. So grabbing our massage ball, we're actually going to stand up now, and we're going to place the ball under the arch of your left foot first. So the arch is here, and you're just going to gently lean into it and notice, how it feels first of all. Are you okay with this amount of pressure? If you have a spiky ball, those are a bit more aggressive. I have a softer one here, so hopefully you can grab the soft one, or sometimes soft balls are also more accessible to you. From here, after we do this a couple times, we're going to begin to roll it up and back towards the heel, more so on the inner arch aspect. So our feet actually has 4 layers of muscles. I'm sure you learned before, but the 4 layers of muscles are very important for dancing, of course, but for many different things that we actually end up losing because we wear shoes. And so the purpose of doing yoga barefoot is to relearn how your foot can actually ground yourself, how it can move in different directions. So it's good to bring more awareness. Now I want you to bring it almost towards your toes, to the lateral 4 toes. And I want you to think about curling your toes around the ball. So it seems kind of strange, but this is a good motion to do flexion with your toes. So I'm extending when I pull it back, when I pull the ball behind, and then rounding my toes around the ball when it's forward. Do this a couple times. 3, 2, and 1. Good. Switch sides. So right arch this time. Just starting to get acquainted with this pressure. And how does it feel on this side? And then beginning to roll from big toe down to your heel. And then when you're ready, coming more to the middle of your foot, trying to wrap your 4 little toes around the ball. And then to the center and round again. Extend, round, extend, round, extend. Good. I actually did a really good exercise reel for toe exercises that actually got really good response. So I want to bring more awareness to that as well. Now we're gonna focus on just moving individual toes. So I want you to think about lifting your big toe up, then placing it down, doing that again, and down. So this is literally controlled by one muscle and one tendon in our calf. Up and down. Good. Now I want you to lift the 4 little toes up and then placing them down, keeping your big toe down, all little 4 toes up. And when you put them down, spread them out and bring them up again and spreading them out. And last one, up and down. Now we're going to alternate. Big toe lift, down, 4 toes, and big toe, switch, and side 4 toes, down. That's their name, side four toes. Big toe lifts, down, and small toes. Last one, up, down, 4, and down. Good. Hopefully that was kind of a challenge for you at home or wherever you're listening to, but always great to incorporate more foot massage, foot exercises, especially if you're dancing barefoot or in socks. All right, so now we're going to work a bit more on our upper back and neck area. So we're going to go back to our tabletop position. We're going to do some thoracic rotation. So with that movement, we're going to reach our right arm up towards the ceiling and try not to lean back on the hip, right? Many times, maybe not that extreme, but people might lean more into the hip to get more rotation, but really be true to your spine and just lift from the arm up. As you exhale, threading the needle underneath the armpit towards the other side. Inhale, reaching up. And exhale, reaching under you. Last one here, inhale. And exhale. Now we're going to land on the outside of the shoulder. And you're going to feel a beautiful stretch from your scapula and your spine. I'll do the other side just to show you what that looks like. With the bottom hand, you're going to gently press into the floor and feel more engagement of that muscles, more stretching of the muscles around the shoulder blade. Deep breath in and out. Beautiful, slowly coming back to our tabletop and doing that on the other side. Our left arm begins to lift up. Then exhale, reaching down and under you. 2 more times here, left arm, under you. Last one. And now landing on that left shoulder. Top hand can reach up and over or half bind. That's up to you. Deep breath in and out. Good, and coming back to our neutral tabletop spine. Begin to do a couple cat-cows just to reset your upper back, lower back. Do a quick body scan and notice, maybe some spots aren't as tight as they were before. And last one here. Beautiful. Now we're going to grab our blocks, or hopefully if you have a foam roller, we're going to do that as well. And if you have the 2 blocks, you're going to place one in the center for your thoracic spine, one just like this to support your neck. So it kind of becomes this T shape in the middle of your mat. What you're going to do, you're going to begin to lie on top of this. And my hands will come up towards the ceiling. This will be our Shavasana Pose. And so I want you to gently find the position that works best for you. Hopefully, I cannot see you, but hopefully this way works. If you have a foam roller, you want it also vertical along your spine, and you want your head to be supported by the top part of it. If it's not long enough, you can grab a pillow or another block and put that on top. All right. I'm just gonna stay here for a couple moments, but I want you to close your eyes, breathing into your diaphragm. This is opening our chest, opening our diaphragm up, so it's more accessible to you. And exhale. A couple more times for yourself. I hope you are enjoying this Shavasana, but I wanted to thank you all for showing up today and being open-minded and learning more about other ways you can support people in dance or yourself perhaps, and that at the end of the day, what brought us together was our passion for movement and expression through the body.
And so with that, I wish you a great evening, and I hope you would learn something valuable that you can now incorporate into your lifestyle, perhaps. And here I will say namaste. Thank you all so much for attending my webinar. I hope to see you soon.
Thank you so much. That was wonderful. I really appreciate your support in providing this for our audience, and it was so relaxing, and well, I feel like I learned a lot. So thank you very much. I would like to take this opportunity to also thank everyone who joined us today, as well as our partners, of course, Joyce Fu Chiropractic, Pivot Dancer, Made to Move, our series sponsor, the School of Toronto Dance Theatre, digital sponsor, Quinte Ballet School of Canada, and our community partner, Go Ballet, for their support. We would love to offer more educational opportunities for you, our audience, in the future. And to do so, we really need your support. So if you enjoyed today's session and are able, we would love it if you would donate $5 to $10 to support our educational mandate at the magazine. As you probably know, we are a nonprofit organization, so every dollar really does help. You can donate right in the registration link where you signed up, and I will pop that in here into the chat. Yeah, so thank you again. This is the last session. So normally I would say, you know, we'll see you next week. So it's kind of sad to be ending the session, but hopefully maybe in the fall or hopefully sometime soon, we'll be able to make something happen again related to dance health. We had some great feedback. And if you have any feedback, please feel free to email me, Emily@thedancecurrent.com. Thank you as well to everyone who has donated so far and who came today. We appreciate your support. We appreciate you supporting the magazine. If you haven't already, follow us on social media at The Dance Current. And you can follow Dr. Joyce at JFU Chiropractic. And I hope you have a great evening. Thank you, everyone.
Thank you so much.
Take care. Thank you. Bye.
Bye.